Hello friends, welcome to my YouTube channel Nursing Classes, a place where you get all nursing competitive exam MCQs and theory classes. आज की इस वीडियो क्लास में हम एसआईसी नर्सिंग ऑफिसर एग्जाम 2019 का क्वेश्चन देखने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरे YouTube चैनल को सब्सक्राइब नहीं किया है तो प्लीज सब्सक्राइब करें और बेल आइकॉन पे क्लिक करें जैसे कि वीडियो अपलोड होने पर पहले नोटिफिकेशन मिले। और वीडियो अच्छी लगी तो अपने दोस्तों के साथ शेयर करें। चलो अब शुरू करते हैं। 1. Schultz method and Matthew Duncan method describe. A. Methods of detachment of placenta. B. Delivery of the presenting part. C. Ways of presentation of the fetus. D. Ways to monitor fetal heart rate. Correct answer A. Methods of detachment of placenta. 2. Bleeding in the first trimester with no uterine contraction or pain and no dilation of cervix indicates. A. Inevitable abortion. B. Threatened abortion. C. Missed abortion. D. Complete abortion. Correct answer B. Threatened abortion. 3. Which of the below is an example of unintentional tort? A. Assault. B. Invasion of privacy. C. Negligence. D. Defamation. Correct answer C. Negligence. 4. The mode of inheritance of cystic fibrosis is A. X-linked disease. B. Autosomal dominant. C. Autosomal recessive. D. Non-Mendelian. Correct answer C. Autosomal recessive. 5. Repeated involuntary or intentional passage of feces by a child in inappropriate places, after the age when bowel control is normally expected, is called A. Nightmares. B. Night sweats. C. Enuresis. D. Encopresis. Correct answer D. Encopresis. 6. Intermittent claudication is a sign of A. Nerve injury. B. Peripheral neuropathy. C. Myocardial infarction. D. Arterial occlusive disease. Correct answer D. Arterial occlusive disease. 7. The type of assessment done to compare the client's current status to previously obtained baseline data is called A. Problem-focused assessment. B. Time-lapsed reassessment. C. Emergency assessment. D. Initial assessment. Correct answer B. Time-lapsed reassessment. 8. The full form of daily in the context of community health is A. Disability adjusted life years. B. Disease adapted life years. C. Disability adapted life years. D. Disease adjusted life years. Correct answer A. Disability adjusted life years. No. The Adam's apple is formed by A. Thyroid cartilage. B. Cricoid cartilage. C. Hyoid bone. D. Epiglottis. Correct answer A. Thyroid cartilage. Thus, which of the below is not a function of the fibrous skeleton of the heart? A. Conducts the impulses from atria to ventricles. B. Forms a structural foundation for the heart valves. C. Prevents overstretching of the valves. D. Acts as a point of insertion for cardiac muscle fibers. Correct answer A. Conducts the impulses from atria to ventricles. 11. In a normal average infant, the percentage increase in body length than that at birth, at the age of 1 year is A. 10%, B. 75%, C. 50%, D. 20%. Correct answer C. 50%. 12. Poor skin turgor in neonates and infants indicates A. Dehydration, B. Hypoglycemia, C. Hypocalcemia, D. Hypertonia. Correct answer A. Dehydration. 13. Which of the below is the true statement about the edge zone of the sarcomere? A. It is devoid of thick or thin filaments. B. It contains thick and thin filaments lying side by side. C. It contains thin filaments only. D. It contains thick filaments only. Correct answer D. It contains thick filaments only. 14. The most common cause of retinal detachment is A. Degenerative changes in the retina or vitreous. B. Diabetes mellitus. C. Trauma. D. Brain tumors. Correct answer A. Degenerative changes in the retina or vitreous. 15. Voluntary rejection of unacceptable thoughts or feelings from conscious awareness is called A. Suppression. B. Symbolization. C. Sublimation. D. Substitution. Correct answer A. Suppression. 16. The action of the sympathetic system in the walls of airways is called as A. Bronchoconstriction. B. Increased secretion. C. Bronchodilation. D. Increased gas exchange. Correct answer C. Bronchodilation. 17. A group of related ideas or statements is called A. Philosophy. B. Paradigm. C. Theory. D. Conceptual framework. Correct answer D. Conceptual framework. 18. When a person's blood pressure drops, the kidneys respond by A. Secreting renin. B. Increasing urine output. C. Producing aldosterone. D. Slowing the release of ADH. Correct answer A. Secreting renin. 19. An affective disorder among the following is A. Bipolar disorder. B. Schizophrenia. C. Somatoform disorder. D. Phobic anxiety disorder. Correct answer A. Bipolar disorder. B's. Positive Brudzinski's and Koenig's signs are indicative of A. Hemiplegia. B. Alcohol intoxication. C. Peripheral neuropathy. D. Meningitis. Correct answer D. Meningitis. 21. The genetic exchange process in which donor DNA is introduced to the recipient by a virus is A. Transfection. B. Transduction. C. Conjugation. D. Transformation. Correct answer B. Transduction. Bias. Scrub typhus is caused by A. Rickettsia prowazekii. B. Rickettsia acari. C. Orientia sushugamushi. D. Rickettsia typhi. Correct answer C. Orientia sushugamushi. 23. The hormone that increases water reabsorption by inserting water channel or aquaporins is A. Angiotensin. B. Antidiuretic hormone. C. Aldosterone. D. Atrial natriuretic peptide. Correct answer B. Antidiuretic hormone. 24. The total number of fetal and early neonatal deaths per 1000 live births is called A. Fetal death. B. Intrauterine death. C. Neonatal death. D. Perinatal mortality. Correct answer D. Perinatal mortality. 25. The term veracity in the context of nursing values refers to A. Being faithful to agreements. B. Telling the truth. C. Being answerable for one's actions. D. Being fair and just. Correct answer B. Telling the truth. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोस।